Good evening. So we are starting a session on TOSI. This is called Teleophthalmology Society of India. This session, I'm expecting our chair, Dr. S. Natarajan, shortly will be joining. Somebody is moving. Dr. Arvind is engaged in another role, is the co-chairman for this session. Convener myself, Dr. BNR Subudhi. Co-convener again, Dr. Saknanda. Again, moderator, Dr. Manoj Mathur is busy with another session. You know, some sort of overlapping sessions, and some are running late also. Probably that is hampering our audience here. But however, people are joining. As the people join, we will continue. So I will be starting the session. Let me give the introduction to you about the teleophthalmology and how it is helpful in the eye care, community eye care. Along with me, Dr. Krishna Vaithishwaram, who has done a lot of work in the teleophthalmology, he will be also explaining. And of course, Dr. Natarajan is an encyclopedia of teleophthalmology, he will be speaking on diabetic retinopathy. So in these few words, I welcome you all to this session on TOSI, that's a teleophthalmology session. So I thank midterm conference, specifically our chairman scientific committee, Dr. Partha Viswas, giving the opportunity in the last two conferences of AIOS, one full session of 90 minutes on this budding topic, that's a teleophthalmology. As you know, the teleophthalmology is the born, no doubt it was there long time back, but it was born out of necessity in the COVID times, as there's a lot of lockdown, shutdown. It's really difficult for the patients to come out of their house to reach the ophthalmologist. At that time, many of us have practiced over so many social media for contacting the patients and taking dictated treatment and advices, everything. Even a lot of post-operative follow-up also done to the teleophthalmology. Thus, teleophthalmology has become a regular feature now post-COVID era too. So, as you know, there is a lot of growth in the IT. In the recent years, there has been an exponential growth of information technology. Its impact in all areas, including the medical field, where accessibility is a major problem, particularly in the COVID era, or when there is epidemiological infections. So in order to make eye care services accessible to everyone, the concept called teleophthalmology has come into existence. Eye care, especially remote areas. India is a country of diverse cultural heritage and geographical location, mostly remote and tribal areas. Whichever state you go, you will get a lot of remote and tribal areas which play a critical role in delaying the diagnostic of many eye diseases in the early stage, leading to unnecessarily and needlessly blind, making the people blind. And again, the proportion of doctors, definitely it's very disproportionate. One ophthalmologist in 1 lakh population, which is necessity of having a 10,000 population. We have got a 1 lakh population, one ophthalmologist. And majority of them, 80% of them live in the urban areas. They practice in the urban areas. Because we have the medical colleges in the urban areas only. We don't have a rural medical college. Where even if we come from a rural area also, we, after studying for 10 years in urban area, we do not find our lucrative opportunity to go to rural area to practice. And again, similarly, 80% healthcare resources are available in the urban areas only because we are practicing all the modern facilities, modern equipments are available with us in the urban areas. And none of the modern equipments has reached the peripheral centers, rural centers, either by government or non-governmental sectors. And as you know, but in India, 80% people are in rural areas, in socio-economically poor places, villages, I would say. And not every nook and corner of our country is easily accessible. There are so many areas, I would say, eastern sector, any state you go, you will be seeing this scenario up in the rural villages where there is no accessibility, no health care. People have to run miles together to get the medical treatment, leave aside the ophthalmological treatment. So, if we can reach, we can take our equipments to that people who are deprived of the modern technology, it will be really beneficial to them. So here comes the teleophthalmology, which has come into play. It's a system that electronically transports a consulting physician from medical center to a site at a distant facility where his expertise is required, moving entire clinic, your urban clinic, to a rural area and practicing, exactly like that. So the concept is that a van equipped with all these equipments, a lot of portable equipments are available. You can take this, and this van moves to the different rural areas where either a local doctor or a paramedic, even ophthalmic assistant, ophthalmic optometrist, even a health worker of a local medical facility, or even if not available, also even a +2 pass person, if you can train him how to handle certain equipments, he will take photographs. And these photographs by artificial intelligence can reach the urban areas where it can be interpreted by a ophthalmologist sitting at the district place or state place or even the central apex center. So this is the concept of teleophthalmology. Through satellite system, the images are transferred from one place to another place. So objectives of teleophthalmology is to make eye care services accessible, affordable by the reducing travel cost and time for the patients. As you know, if an ophthalmic patient of elderly person travels for a long distance, he has to be accompanied by 2 other persons to carry him. And there's loss of wages also. These people who are earning, they lose their wages because they have to carry the patient. It is not a single. Suppose a patient suffers from diabetes retinopathy, he has to make a frequent visits. And frequently it is not possible for his attendants to take him to the urban area for the treatment. And to enable the people in remote areas to have access to the specialized eye care facility, to act as an interface between doctors to share their experiences. The scope of teleophthalmology in India as a patient care, expert opinion, comprehensive eye exams in rural areas, and eye screening, particularly school children for the refractive errors. The diabetic retinopathy screening, and early stage, if you can detect the diabetic retinopathy, probably you can treat them early and prevent them from becoming blind. Glaucoma also. If you screen glaucoma patients early, again they become cured, or we can prevent them blindness in them. Teaching and training, even remote areas, rural areas, you can teach them by having a teleophthalmology education. Then awareness. Many awareness programs about the eye health can be done through the teleophthalmology. So prevention of blindness can only be ensured by regular eye screening of the entire population of the country for early detection of blindness like glaucoma, diabetic retinopathy, ARMD, also uncorrected refractive error of the children. Again, simultaneously there is a lot of advanced technology, digital technology, use of digital technology of fundus imaging at the primary health center level, use of wireless broadband and network for the transmission of images, use of artificial intelligence and deep learning for the interpretation of images and identification of early changes can help. With the limited technical manpower and those mostly confined to the urban areas with a majority of the population staying in rural areas, it is practically impossible to provide eye care to all. So use of digital technology with the paramedics and trained health workers, as I told, using teleophthalmology, it is easier for the early detection and regular follow-up of these patients to ultimately prevent them from becoming blind. So teleophthalmology advocates incorporation of the above approaches in eye care services of the future with the introduction of 5G. As you know, recently 5G was introduced in our country, and it makes the network very faster. So at short time it reaches the people. So to conclude, teleophthalmology is an exciting technology, new technology which can help in integration of all urban and rural healthcare centers in India and improve the quality of medical services in the presently underserved and improvised sections, particularly remote rural areas of developing countries like India. So thus, because of all this, we have formed this Teleophthalmology Society of India with our Dr. Natarajan as the chairman of this society, the president of the society. Our aim is to integrate all the people doing teleophthalmology in various parts of the country. Now, a lot of Shankar Netrala, L.V. Prasad, Arvind Eye Care System, all they are doing the teleophthalmology, but they are not individually. We want to integrate all this to make a power of teleophthalmology, and so that at least we can have some guidelines for other people too, those who are interested in doing the teleophthalmology. So, this is our website. So, anybody can join this Teleophthalmology Society of India. It's a membership is very bigger membership we have kept, and website is dosi.org.in. Please go to the website, you will find out this application form. You can write to me also about this form. I have sent you. Please be a member and strengthen our hand, coordinating, integrating all the teleophthalmology networks in our country. The science is developing. In next 5 years, we'll see that teleophthalmology becomes a major treatment facility for all, whether urban or rural. So this session is intended to sensitize the participants to utilize teleophthalmology services with artificial intelligence in the daily clinical practice with the use of affordable and cost-effective portable equipments and technology to reach the nook and corner of rural India and to support and assist the country's goal of National Digital Health Mission Campaign. So this is the session. I've got the speakers with me. Dr. Natarajan is there. He's the chairman of this session too. Next will be Dr. Prasanna Venkatesh and Dr. Krishna Vaidyasal, Dr. Sabyasachi Patnaik. So already I've told I'm the chairman, Rubia Hospital, and I'm the secretary of the TOSI at the Television Society of India. And our president is Dr. Padma Shri Professor Natarajan. He is the past president of AIOCMTC. He is one of the speakers of this. Everybody knows him. I don't have to introduce him to the people here, sitting here. And of course, Dr. Sandeep Rai, who is from Tripura. As you know, Tripura has really wonderful, done a lot of things in teleophthalmology work, but unable to come because of some commitments, local government. So he is not joining us. Dr. Prasanna is joining because he is all busy in the other session. He will be joining shortly. He is a consultant at Mahatma Eye Hospital Private Limited. He is MS from Mahatma Gandhi Medical College Research Institute. He has completed his 2 years glaucoma fellowship training from Satyan Eye Care Hospital. He is the research director in glaucoma head at the Mahatma Eye Hospital Limited, India. He has got a lot of publications and both in the articles and the journals and the books also. Dr. Sabyasachi Patnaik, another speaker, is joining shortly. Presently working as Additional Director of Health Services, Senior Consultant of the Rourkela, Odisha. He is trained at Arvind Eye Hospital, Madurai. He is the treasurer of our TOSI. Dr. Krishna Vaitiswaram is the consultant ophthalmologist at Mulchana Medicity Hospital, Lajpat Nagar, Delhi. He is from MS from Maulana Azam Medical College, the Best Resident Award at Guru Nanak Eye Center in 1995. He has received several awards, he has several publications, and he has worked extensively teleophthalmology, algorithms, designs and deployment. He has come for this session only, all the way from Delhi for this session. So, Dr. Gawar Ahmad, he is practicing in Kashmir. Again, due to some commitments, he could not join today. He was promised me to join this program. But however, we will miss him. So these few words, I thank you all. No doubt the audience is low, but still then we have a lot of hope that we will proceed further. So may I request our chairman, Dr. Natarajan, to come, not only give introductory speech, but also he has to talk, his talk. So thank you once again for the patient hearing of this teleophthalmology. May I request all of you to cast your valuable vote for me for the editor proceedings in the AIOCMTC election 2023. Thank you very much.